Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Bethesda criteria, that is the MSI testing. So here we look at the Amsterdam criteria or one of the following. The Amsterdam criteria or one of the following. So it includes two cases, and this is of the HNPCC. It is associated with the cancer in one patient, so it is with cancer in one patient, and including the synchronous and the metachronous cancer. So it includes the synchronous or the metachronous cancer. Next we have the colon cancer. So colon cancer and the first degree relative with the HNPCC, and it is associated cancer, and or the colonic adenoma or the colonic adenoma. So here in one cases of the cancer diagnosed before the age of 45, so before 45 years, and the adenoma, so cancer less than 45 years and the adenoma before 40 years, and adenoma is going to be before 40 years. Then when you look at the colon or the endometrial cancer, the colon or the endometrial cancer, so this is diagnosed before the age of 45, and there is a right-sided colon cancer. So this is diagnosed before the age of 45. So this is before 45 years, and there is a right-sided colon cancer. So that has undifferentiated pattern. So it has a undifferentiated pattern. That is, it can be solid or the cribriform. So it may be solid or the cribriform, or it may have a signet ring histopathological characteristics. So it may have signet cell histopathologic characteristics. This is diagnosed before the age of 45, before 45 years. Other thing to note is the Bethesda criteria. So this Bethesda criteria is used for the reporting the thyroid cytopathology. So it is used for reporting the thyroid cytopathology, and which guides the clinical decision. So this will guide the clinical decisions. To learn and grow daily like this, please do subscribe.